Today is June 4th, 2025. My name is Evan Powell and I have ocular melanoma. Yesterday I got my radiation plaque placed and I'm in a four-day session of brachytherapy. And here we go again. This is my third eye drop for the day. I'm doing 4 eye drops per day for 4 days. This is Wednesday. I had my plaque placed yesterday, so I'll get it out on Saturday and then hopefully be able to get back to normal a little bit. But I'm gonna get my treatment going here, and I'm gonna okay. Huh. So as far as how I'm feeling pretty good. I've eaten light today. I had breakfast, which I mentioned before, and just for dinner I had a smoothie and a roll from Texas Roadhouse. But I was finally able to number 2. Huh? Yeah. Well, same thing. Bowel movement number 2, which I wasn't feeling any discomfort, but I just wanted to get that passed in order to feel like, okay, everything's back to normal a little bit. So my wife reminded me to update you on that. Hopefully that wasn't TMI, but
I think people need to know.
Yes, absolutely. You're right. So I can see the light through the eyelid. I've only taken 2 Tylenol today, which is good. I haven't had any pain or discomfort. Like I said, just when I move my eye, I can feel what I think is a stitch scratching, but other than that, I can't feel the plaque or anything else. Yeah, it does weep quite a bit. It's, for the most part, it's clear because there's no blood on my... There hasn't been any blood on my gauze for the past couple times. Is there now?
No.
So it's just weeping tears, I think, which I think is good. The hospital tried to call me during my... Oh, I mentioned that before. During my nap, but my phone was turned down, so I missed that call. I think they call once a day just to make sure everything's going all right, but... I don't seem to have any issues. Yeah, sure. So Pam's gonna pull my bottom lid down to expose my eye.
I'm gonna have to put some.
Is it sticking?
It's sticking, so let me get the hot compress.
So yeah, the past few times my eyelid has started to stick together. The eyelashes have started to stick together. It doesn't hurt when they pull apart, but it's definitely not comfortable because that whole area is tender. So I hope everybody's doing well, doing good. I'm thinking about everybody out there in OM world and in the C world, you know, being superheroes, fighting for their life, their love, their passion.
You might want to stick that a little bit. Oh, sorry, babe.
It's all right.
Let me go over both of them, and then you can push it down a little bit into your eye. And remind me that I wash my hands before I do any of this.
Oh, so Pam does sanitize her hands before she helps me, in case anybody's wondering about possible infection. In fact, that's what these drops are for, to help prevent infection from setting in my eye. They gave me a drop before surgery of the anti-infection eye drops, and then I did 3 yesterday, and this is my 3rd today. It's about 7 p.m. And then I'll do a 4th drop before I go to bed at 10. And then we'll carry on to day 3. Yeah.
And you have your eye just to see if
It hurts to dab. I can't put any pressure on it.
Then that's good.
Ooh. What's this?
That's your
Is there any blood on it?
No. I'll take it off though. Sorry. It's squeaky though, so I'll change it. Okay, we're gonna attempt to open your eyelid again. The drop is it's thick, so that's probably why it's sticking.
Is it like a gel?
Kind of.
Is it really? There it is. Yeah, good job. Yeah. Oh, I can see you. That's the first time I saw your face out of that eye. Hi, baby.
Hi, sweetheart. Your eye's still really
I can
dilated.
totally see you. I can see your eyes moving and everything. That's awesome.
Yay.
Wow.
I'm gonna have to kind of open
My
it.
eye is still dilated though?
Yeah.
Big pupil?
Yeah.
Oh, it's dripping.
Yeah, let me get this.
I hope you
got
feel
it
like
in.
you got enough in?
Yeah,
Okay.
I did too.
It's
so.
behind my ear too. Thank you, baby.
Yep.
So there you have it. I don't know. I can't really see. I'm still unable to open my eye on my own, my upper eyelid or my lower eyelid. So that's why she pulls it down and just drops in the bottom lid.
I'm gonna try and open it.
Open my eye.
Yeah.
Oh, for a picture.
Yeah.
Wow, I can actually see. I can see the camera. I can see really good, actually. I was worried about that. Are you done?
Yes.
Oh, you're gonna gauze me and stuff? Okay. So, as I was saying, I'm thinking about everybody out there. I love you all. I appreciate all the support that I'm getting online in the OM groups. All you patients and survivors and superheroes and advocates and caregivers, you're all amazing people. You're all, you're what keeps us alive, keeps us going. Even me, I came into this 6 weeks ago and had no idea
It's the patch.
what was coming.
I found that it's easier if you're putting the patch on to diagonal the tape. It just stays better, and you only need one piece of tape that way. Just FYI.
Yeah, good. The little lead patch that she's putting on, it's a little awkward and a little bulky, and at times it feels like it's falling off, but I haven't had too much of a problem with it staying on. One time it flopped down when I was sleeping.
And if anybody has any ideas on how to do this patch, because it is hard, I'm going to try the diagonal as well and see if that only needs one then. But that's the harder one to keep on.
That should be good right there,
I'm
though.
going to
Huh?
try that and see what happens.
Feels secure. It's some pressure on my eye, but all right. So that's drop number 6, right? Yeah.
Yes.
All right. So I love you all. Stay strong and get your eyes dilated. Tell somebody or encourage someone to go get a dilated eye exam. Know your eyes. They see everything. Ask if you have a freckle in the back of your eye or any abnormality. And if you do, just be aware and get frequent dilated eye exams and note any changes in the freckle. Once that freckle decides for some reason to start growing, it can develop and grow without any symptoms whatsoever. The only way that mine was caught was because it had begun to affect my vision. And I went to an eyeglass convenient. Got an eye test there. They did not give me a dilated eye test. Obviously the glasses didn't do me any good. So then I went and had a dilated eye exam, and those are the images that you'll see on my Facebook page. I'll post them. The first image of the inside of my eye. I had never had an eye exam, a dilated eye exam in my life. The only eye exams that I had had prior were for physicals and driving tests. But as soon as I saw that image, I knew. And my first feeling was, I don't know. It's a shock. So that was, I think, maybe 8 weeks ago, 8 or 9 weeks ago. And then 6 weeks ago, I got my diagnosis. And yesterday, my doctor, the doctor that diagnosed me, placed my plaque for me, and he'll do my follow-ups. I'll do a 30-day visit, and then I think a 3-month visit, and then every 6 months after that, unless he changes it. So get your eyes dilated, or get dilated eye exams. Encourage other people to do so, and have a good night. I'll record my 4th eye drop later, and then we'll be on to day 3. I love y'all. See you in the next video.